Hi, doctor. Now these days we are listening lot of weight loss options available in the market. Could you please suggest what are the weight loss options available?
Hi, myself Dr. Karna Vemula, Senior Cosmetic and Plastic Surgeon. At Personiks, we have a lot of options available for the weight loss. But the new buzz in the market is about the injections available for the weight loss treatment, which people are opting for the easy makeover themselves. Like the most important, like FDA approved injections are Ozempic, which contains semaglutide, and the other one is the injection Monjuro, which is terabeptide. So these are the two common injections available for the weight loss.
What is Monjuro, doctor?
So this injection Monjaro is it is initially invented for the diabetic medication, but this is the Monjaro, which the drug which is there is terzapeptide. Okay, so basically this injection is a GLP-1 and GIP receptor activator basically. So these, by stimulating these receptors, this will decreases the intestinal motility and decreases the appetite. Then second thing, mobilization of the fat, thereby eventually leading to the weight loss.
So is Monjuro used for weight loss also?
Yeah. See, actually, as I was saying, Monjaro is started for the diabetic management, but then they started seeing very good improvement in the weight loss. So that's how they started now purely using for the weight loss also.
How it is taken?
This injection Monjaro, it comes like kind of a pen. I just want to show. So this is a pack of 10 mg, 5 mg. It also comes as 2.5 mg, 7.5 mg, then 10 mg, then 12.5 mg, and 15 mg. And this comes like a pen. So this comes like a pen which has a meter dose. These are already pre-filled injections. We need to just turn the thing, load it, and take it under the skin. The under the skin means it can be taken on the forearm, on the tummy skin, or on the thigh skin, just under the skin. So that this comes as like a weekly one dose. So which will be most attracting feature. If you look at diabetics where they need to take every day injection, but this what weekly one injection and it's painless. That's why it is very crazy going in the market.
How much weight loss can we see in this?
Okay. This particularly if the non-diabetic and who are obese, they can see as per the studies 16 to 20% weight loss. Somewhere ranging from the 4 months to 6 months duration, they're able to lose 16 to 20% weight loss. Suppose somebody 100 kg weight loss person, they can lose up to 15 to 20 kilos over a period of 4 to 6 months.
Is it same for both female and male?
Yes. And what I have seen in my practice, the females respond more faster and quickly, maybe because of the loose fat available for the thing.
Who should not take Monjuro?
Basically, the mainly breastfeeding women, pregnant women, and somebody who are who are known thyroid cancer patients, they should not take. And even the children's, it's still not clear. It's a gray zone.
Are there any side effects after taking?
Yes, very good question. Actually, people are worried about if so crazily decreasing the weight, is there any serious side effect? It contains a mild side effects like nausea, vomiting, and burpings, and little GI symptoms of diarrhea sometimes. This can happen first few days. Once the body get adjusted, then things will get stabilized. But there are few serious side effects in the long term, like somebody who's taking years together, they are expected to have a little pancreatitis and arthritis, again very rare. And second thing, in animal studies, they have proven that thyroid cancer can be possibilities. In the animal studies, nothing in the human. That's why we avoid giving somebody who's having thyroid cancer.
How does it working even on insulin resistant, doctor?
Okay. So, if you look at the mechanism and pathophysiology of this drug action, so this basically what this GLP-1 receptor and GIP receptor activation leads to release of insulin. It's like a massaging the pancreas and liver, releasing into the insulin, thereby more utilization of the glucose, and liver starts emitting about glycogen, And then next energy source of fatty acids from the fat cells. Thereby, there is a decrease in the size of the fat cells. And second thing, utilize like fatty liver and all those things will come down. And most importantly, it also affects central nervous system by improving their appetite, satiety center. It will like if you feel as if you are not hungry. So there will be an aversion food. You don't feel like taking the food. And second, the most one more important action is that it decreases the motility of the intestine. Thereby, whatever you take the food, it will stay for a long time. Thereby, you don't feel hunger to retake. So, one is clearly the hormones will be more released, like insulin and glucagon, like peptides. And then second is decreasing the motility. Third is appetite inhibition in the brain.
So, and also, we have one more doubt is could you please rate side effects with the obesity and side effects for Monjuro once they take a Monjuro, if they come down, like people are worried about if we take Monjuro, are there any side effects?
Okay,
And
understood.
could you please elaborate?
So either I understood because either they need to stay with obesity and face the consequences of obesity,
Yeah,
or take the Monjaro and face little side effects.
exactly. Yeah.
See, if you look at obesity, obesity has lot of complications, both psychological and physical. So physically, there can be uncontrolled diabetes, then hypertension, cardiac overload. Most importantly, snoring, which lead to sleep apnea syndrome, their insomnia, which lead to disturbed family relation, and also their work capabilities will come down, all these things. And they may not be physically active, and psychologically, they're like depressed, they'll be secluded, they may not be exhibited in, and they may not be active in social gathering. All these things psychological is the individual feeling, but physical, it happens with everyone. So, facing those complications are much higher than the whatever the minimal side effect happens with the Monjuro. So, this weight loss injection Monjuro can cause initial symptoms, like especially GA symptoms like nausea, vomiting, and diarrhea. What I have seen in my practice, it will be only last for a few days. Once like body get adjusted.
What about the metabolic rate in the body, doctor? Like when we take Monjaro, so are we seeing any downfall in the metabolic rate, or like how can they increase the metabolic rate?
See, here with the Monjaro, not like fasting. During fasting, what happens? You feel hypoglycemic and you'll get headache and other thing. Here with the Monjaro, you don't feel those symptoms because these injections mobilize enough calories from the body so that the glucose levels in the blood will be maintained. Okay. And second thing, basal metabolic rate increases. So what we adjusted along with that, there should be a physical activity, minimal physical activity in terms of exercise and other things to balance overall.
Okay,
health.
so should it be taken lifelong to maintain that weight?
Good question. So usually for the weight loss, we suggest somewhere between 4 to 6 months. And once you reach the targeted weight loss, you need to have certain lifestyle changes also. You not just depend on the injection and then go back after 6 months and eat yourself, then complete rebound weight gain will be there. So if you have the weight loss or lifestyle modification, mainly two things. One, decrease in the calorie intake. Second thing, exercise. Some amount of adaptation of exercise should be there, which makes it more balanced, and reward weight gain can be decreased. And most important, when we stop, we should not stop abruptly. So we need to decrease the dosages. Like you would have been taking 10 mg, 12.5 mg, come down to 10, then 5, then instead of weekly, 2 weeks once. Then overall amount of rebound gain will be not so much.
Should be taken at the premises of the doctor, or else can they take it even in the houses?
Yeah. It's like an insulin injection where you like anybody can take. Just we need to turn. There'll be a fixed dosages and put it under the skin and press it. So that can be once first time we'll demonstrate how it should be taken little sterile precautions, and every time we can administer at home also it can be made.
Thank you so much,
Yep.
doctor.